Mm, Good morning. Today we are discussing about the topic endodontic instruments. So I'll be discussing under the following headings. I'll be talking about introduction, classification of endodontic instruments, standardization of endodontic instruments, the make of endodontic instruments, the various terminologies associated with endodontic instruments, and I'll be discussing detail about the hand instruments, rotary devices, and various clinical considerations, and followed by references. So in this topic, what we are trying to convey is that, as you all know, the endodontic is mainly dealing with root canal therapy, the different steps involved in root canal therapy, right from access opening, cleaning and shaping, work in the determination, observation, all the steps involved in instruments, we are employing a lot of instruments. So we should have a thorough knowledge regarding the instrumentation, the manner of use, the different types of instruments, technique to use the instrument, everything in detail, along with the various anatomical landmarks as well as the various anatomy involved in the root canal procedure. The instruments play a very important role in the success of root canal treatment. So therefore, a basic knowledge of endodontic instruments is very important. So regarding the guidelines which exist for root canal preparation, due to the, as you know, because of various complex and varied root canal anatomy, each case is very different and it presents unique challenges. So variety of root canal instruments are thus available for this purpose. We'll be discussing shortly. And before discussing instruments in detail, let me discuss about the endodontic instruments proposed by, classification of endodontic instruments proposed by Grossman. As I mentioned earlier, based on the different steps involved in the root canal procedure, that is first access opening, debriding of canal, cleaning and shaping and observation. So depending on the different steps involved, different instruments are also employed. So first and foremost, the exploring instruments, followed by debriding instruments, and the cleaning and shaping instruments, and observing instruments. And the exploring instruments, mainly now we use endodontic explorers, smooth broaches or pathfinders we use. And the debriding instruments are these instruments used to extricate the pulp and the remove any debris it presents, mainly knob broaches. And the cleaning and shaping instruments are the instruments which is used for cleaning as well as shape the root canal. And mainly they are reamers as well as files. And observing instruments, the various instruments is used to fill the prepared root canal space with the help of special data per. And the cleaning and shaping instruments are again divided, classified based on the FTA into the group 1 to group 6. The group 1s are mainly hand use instruments, which is basically K-files as well as H-file. And the group 2 is engine-driven latch type of instruments, that is case-driven drill as well as bezo reamer. And the group 3 is mainly engine-driven night-day rotary instruments, that is profile, protaper, and other companies are available. The group 4 is nothing but the engine-driven 3D adjusting instruments, that is mainly self-adjusting file system. And the group 5 is engine-driven reciprocating instruments, that instrument is rotating to and from motion. Followed by last group 6, that is sonic and ultrasonic instruments. Now coming to the instruments which is used for diagnostic purpose, it is mainly divided in endodontic explorers, tooth sleuth, dental tonsil illuminator as well as pulp vitality tester. Endodontic explorers, you can see these explorers, most of the cases now, root canal after access cavity preparation, the canal is blocked with various debris or the pulp stone, etc. The patency will not establish. It is only the initial entry will be blocked. So in order to explore the canal, we can make use of endodontic explorers. It's just like a sharp probe. We are removing the obstruction and we are establishing creating the orifice patency. Once the orifice patency is established, then we can easily insert the file and establish the root canal patency. Okay, and second diagram which is been showed is the tooth sleuth. Okay, the tooth sleuth is mainly used to diagnose a clinical situation known as crack tooth syndrome. The crack tooth syndrome is a condition wherein there is incomplete crack present in the tooth, which is present in the enamel, dentin, and it's almost approximating pulp. So in order to diagnose, so these patients with crack tooth syndromes often have pain on biting as well as there will be pain on relieving the bite. Okay, so the patient is asked to bite on a specially designed instrument called as a tooth sleuth. So whenever the patient bites, or more often whenever the patient releases the bite, the patient gets pain. Okay, so whenever the patient bites as well as whenever the patient relieves the bite, patient gets pain. That is a clear-cut indication of crack tooth syndrome. And the third diagram which is being displayed is trans illuminator. The trans illuminator is nothing but an LED light is being displayed, projected. This LED light helps to determine the presence of minor cracks, grazed lines, etc. on the tooth. The last instrument which is showed in the diagram is pulp vitality tester. So basically, the pulp vitality is to, these instruments are used to assess the vitality of the tooth, whether the tooth is vital or whether the tooth is non-vital. So basically, the pulp vitality mainly two types: the heat test as well as thermal test as well as the pulp vitality test. Thermal test are again divided into heat test as well as the cold test. So in the image which is showed is called electric pulp tester, and in this image, basically the electric pulp tester is employed. So it has a, it is a device. It's a battery operated device, and it has got a probe. Okay, the tip of the probe, it can deliver electricity. So we can control the amount. We can control the electricity with the help of a knob. That means if you turn the knob to a maximum, there will be minimal resistance and maximum current. So what you have to do is you have to complete the circuit. We have to insert the lip tube into the patient's mouth, and we have to make the probe test the patient's tooth to be tested. Okay. And once the patient feels tingling sensation of warmth, then the patient's tooth is vital. If there is no response, the tooth is non-vital. And the other interpretation is called the false positive as well as the false negative. The false positive means actually we are supposed to get a negative response, so we are getting a positive response. So its main reason could be liquefaction necrosis. That is clinical situation in which one or the other root of the tooth is necrosed, but other tooth may be vital. Okay. So because of clinical situation called liquefaction necrosis, we may get a false positive response. Another interpretation is false negative. False negative means actually we are supposed to get a positive response, but we are getting a negative response. This could be because the patient have had painkiller, that is when sedated patient, the presence of thick base underneath amalgam restoration, the traumatized tooth, incomplete tooth formation. All these are examples of false negative response. So moving on to various instruments used for access opening. So as you can see in the diagram, we have diamond head burrs, tapered bishop burr, carbide burr, safe and long burr, and endosy burr. So first burr which is being displayed is a head burr, which is mainly used to penetrate the root canal for around 0.5 to 1 mm. So when you make an initial entry, this 0.5 enamel is being penetrated, then you can switch it to tapered bishop burr. So the tapered bishop is used to drill through the canal to reach the pulp chamber. So by using these two burrs, we can refine the cavity and make it into a proper shape. Okay. The carbide burrs can be drilled through the restoration as well as through the crown. And once you reach the chamber, then we can switch to Safen burr or endosy burr. So endosy burr and Safen burr has got a non-cutting tip, so we can safely use this burr without making a furcal involvement. Okay, it has blades only at the lateral sides. And coming to the instruments used for canal preparation, there are again based on the different steps involved. The instruments have been divided into instruments used to remove the pulp tissue, instruments used for root canal preparation, and instruments used for root canal obturation. Instruments used to remove the pulp tissue is mainly divided into barbed broaches as well as endodontic excavators. That means, as I mentioned earlier, the barbed broaches instrument which has got various barbs of projection. This instrument is inserted into the root canal only after establishing a minimum patency and minimum enlargement of around 20 size. Once the patency has been achieved and the canal has been enlarged to a 20 size, this barbed broach is inserted, and this barbed broach is withdrawn 1 millimeter, rotated, entangle the pulp, or and pulp is withdrawn. Barbed broach is withdrawn along with the pulp. You can remove the pulp in toto, that is, entire mass of the pulp tissue can be removed with this instrument, provided the technique of usage is correct. And endodontic excavators are the small spoon excavator, which is used to remove the small obstruction which is present in the root canal orifices, and also as remove the bloodstone tissues, etc. And instruments used for root canal preparation, again it is we have various instruments used for cleaning and shaping root canal, mainly divided into reamers as well as files. This reamers, as you can see in the diagram, it is made from triangular blank, whereas files are made from square blank. Okay, this reamers have less number of fluids when compared to the files, and the cutting efficiency is more for reamer, and the reamers density fracture more when compared to the files. And this diagram shows the various instruments used for root canal obturation. The first diagram, lentillar spiral. Lentillar spiral is used along with a slow speed handpiece, which is mainly used for coating the root canal with the sealer, and as well as for coat the root canal with the medicament. And the spreaders, as you can see in the diagram, it is a sharp needle-like instrument, which is mainly used for lateral compaction technique in obturation. Lateral compaction is nothing but we need to, in order to establish a complete three-dimensional obturation, all the spaces, all the space within the root canal system has to be tightly packed with the gutta percha. Suppose you are obturating a central incisor being a tunnel shape, I mean, being a triangular shape. So after keeping the master cone, the additional extra space between the root canal wall and the master cone has to be filled with the gutta percha. So in order to, before introducing the accessory gutta percha, this space has to be made with the help of the spreader. The spreader has to be advanced between the master cone as well as the canal space and create space for the accessory canal, and then accessory canal has to be inserted, and we need to establish a tight three-dimensional compacted obturation. Okay. And as you can see, the pluggers are mainly used to plug the canal to, for example, if you are plugging apical third of the canal using MTA, we can place MTA inside the canal and you can plug the canal and put the MTA into the canal with the help of this plugger. Plugger and canals are almost similar action. In the last diagram, the heat carriers and thermomechanical compactors are mainly used for advanced obturation technique. Okay, this thermomechanical compactors and heat carriers will be discussed in the obturation lab. I think the further slides will be discussing in the next class. The standardization, everything will be discussing in the next class. So let me wind up today and we'll continue in the next section. Okay, thank you.